Marhaba. Good evening. A few weeks ago, the wonderful team at Taibah Hospital asked me to be a guest speaker for today's event, the Endo March Event. When endometriosis was first explained to me, I was completely unaware. For 2 days, I couldn't even say it properly. I met with the charming Dr. Salma, and I did my research and quickly agreed to get on board and help in any way that I can. Partly because of the staggering percentage of endometriosis in Kuwait, 1 in 5 women, and partly because of the nature of this condition and how it affects us women. I will not share the statistics nor the medical details about endometriosis, as this is Dr. Salma's expertise. I would just simply introduce the condition as a disorder, a painful one, where the lining of the uterus grows outside the uterus and attaches itself to other organs like the ovaries and fallopian tubes, instead of being expelled from the body. Setting aside the medical repercussions of this condition, I would just share some of the non-medical effects of endometriosis. In talking with Dr. Salma as well as some of the patients, the psychosocial aspects and the ripple effects are far greater than just the medical condition itself. Patients commonly expressed that the pain was so debilitating, it took them away from school, from work, as well as family and social obligations. That pain is repeated monthly and over a few days. Other patients explained how that pain was a major stressor on their marriage, and it affected their intimate relationships because that pain was unbearable. Very often, these women were unable to explain that pain or their suffering to their partner. They were afraid, they were ashamed, and for many, they thought it was normal. Now, this is the part where I would like to address all women, myself included. As a psychologist, I understand women. As a woman, I understand endometriosis. I may not be diagnosed with endometriosis myself, but the relationship between a woman and her body, especially her reproductive health, is a common theme for all of us. Today's event aims to raise awareness about the importance of having an empowered and positive view of our bodies. No one knows how you feel, or what you go through, or what you struggle with, more than you do. As women, we have been conditioned to suffer and endure suffering. We know that we have a higher threshold for pain, and we don't want to be seen as weak or inferior. There is often shame and secrecy around fertility issues, and many women think that they are less of a female because of these issues. We need to quickly change that mentality. Relying on pain medication or just being able to take it is not okay. Pain indicates that there is something wrong. It is our responsibility to listen to our body. Early intervention in all medical conditions is the best means of action. Do not hide behind that fear. Do not hide behind that shame. Use your strength in keeping yourself healthy, pain-free, and positive. There is no shame in pain. There is no shame in ailment. We are born female, but we grow up to be strong, independent women. Keep growing, keep getting stronger by acknowledging, not ignoring, what your body and mind needs and feels. Self-care is not selfish. Self-care is necessary. Thank you.